This is part 2 of population growth and decline. We have the same essential question: why should we look at population and trends, and then what tools do we have that we can predict different populations and different trends based on different things. We're carrying right along with what we were, because this is part 2. The epidemiological transition model, which I have down here, goes hand in hand with part 1, which is talking about the demographic transition model. You can plug this in right alongside the demographic transition model and get a better look at populations and the stages that they are in. These are the different stages of diseases that can be applied to a people groups. Epidemiology means the medical science concerned with the incidence, distribution, and control of diseases. Diseases are a huge play on population, because without them, the crude death rate would not be as high. But you've got different stages. The first stage is the pestilence and famine stage. This is like the Black Death. That's an example of this stage. A famine that's widespread, wipes out the population. You'll notice that this is before kind of the medical revolution and before medicine, before we even knew about germs. So that's what fits in stage 1. Stage 2 is the receding pandemics. You don't have as many, but what fits in here is like cholera. Key word here is pandemics. This is one of your key vocabulary words for Unit 2. Pandemics is talking about a disease that spreads worldwide, kind of like contagious diffusion, that you can't control it. Okay, it just goes worldwide all of a sudden, like H1N1 virus would kind of be a pandemic, would fit under that stage. Stage 3 is the degenerative and human-created diseases such as cancer and cardiovascular diseases with the heart. Stage 4 is the delayed degenerative diseases. Cancer and these other diseases that we talked about here, like cardiovascular diseases, are actually slowed during this time period, during this delayed time period, because of medicine. Okay, because of the medical revolution. And then stage 5 is the reemergence of infectious and parasitic diseases. It's more prominent in less developed countries. By this time period, we've got the medical revolution, and we should be able to combat these different diseases. Okay, moving right along. Next main point we have is healthcare. Infant mortality rate means the annual number of deaths of infants per 1,000 births. Now, to clear up some misconceptions, this is not referring to abortions. Abortions do not fall into this category. This is actual births of babies and how many live once they are born. Okay, that's what we're looking at. If you are a less developed nation, generally what you have is you have a high infant mortality rate, because that means your medicine and things aren't very good, because you're not able to keep the babies alive. Life expectancy is the average number of years an infant can live at the mortality rate, the crude death rate that's already there. That's how long you're expected to live from birth. Overall, the whole world population, the life expectancy is steadily increasing over all of the countries in the world. It's steadily getting better, and that is because of medicine and the distribution of medicine. In developed countries use their wealth to protect their people by investing a lot of money into healthcare. Even your less developed nations will invest some money into healthcare, but the percentages of how much money is being invested into healthcare goes more toward the developed countries. And what I mean by investing into healthcare, that's not necessarily providing free healthcare to all the people, but investing money into medical practices and those sorts of things. Your developed countries, of course, are going to have higher and better healthcare systems than your less developed countries. Now, I wanted to throw this in here because this is kind of a surprising conception that surprised me. In dealing with fertility control and contraceptives, the Middle East is one of the world's leading fertility control places on keeping the population low. This was really surprising to me, because this area is predominantly a religious area around the Middle East, but you still have a lot of people inflicting in these areas that aren't necessarily in Israel. So it's kind of a key point to look at, because it is a misconception. In the Middle East, they actually have one of the highest fertility controls out of anywhere. Okay? That does not have to be contraceptives. That could also be the government stepping in and saying, hey, we don't need to be doing this, that type of thing, which we'll get to that in a little bit. And the next main point for population growth and decline for this section is an endemic. An endemic is a disease that is prevalent within a people living in a certain area. A pandemic does not have to be within a certain area. An endemic is in a certain area. The example I've got provided for you here is malaria, like in your subtropical regions. You're going to find this endemic disease within this region, and because it's predominantly only in this region among these peoples, that makes it an endemic. Now, second main point of this lesson. We are finishing the population section of the curriculum, so I've got some terms that didn't really fit well with the way I had it organized. So I've got my population modge-podge. I don't have an essential question for this. These are just the key terms that still need to get down that I haven't got over yet. First is the limiting factor. The limiting factor goes with the food availability to control population size. Limiting factors basically say the population is limited based on how much food is available for that population. It kind of goes in with Thomas Malthus's theory, but it is not correlated, but it is kind of similar. Next is genetically modified foods, GMOs. Okay, how that ties into the population section is that some of your less developed nations are compensating for how low of food production they have, and they're genetically modifying their food to get more yield out of the crops that they already do have. So maybe they don't have a lot of arable land that they can be farming on, so they genetically modified food so that the food that is produced is producing more food. Now, the more developed nations are doing this as well, not necessarily for low food production within a country to feed the people, but for money. That'll come in the agricultural section of the curriculum. Next is the urban primacy. Urban primacy is revolving around a primate city, which is kind of a central city that controls the entire government. Most of the time you only see this within Latin America. There are none in the United States. But urban primacy is talking about how the government is focusing all of the economy, all of the money, all of those things towards this primate city. Okay, again, Latin America is good examples of this. This is where the primate city and the urban primacy is going to fit in. Now, the next thing that I've got here is the rule of 70. This goes with the doubling rate. The rule of 70 is the approximate time over the world that it takes for the world population to actually double. It's kind of a inferred rule that within 70 years the population will double. Okay, a few more. Carrying capacity, one of your vocabulary words. This is the largest amount of people that an environment can sustain based on the food production that they have at that point. That's what the carrying capacity is revolving around. The next section says, why does population decline? I kind of skipped over this, but these were some questions that we had in class. People were wondering, well, why would the population decline? There's a couple of things, meaning four here. One is women's rights. Women's rights have been improving all over the world. This has given women the opportunity to go out and have jobs. And because of this, women are no longer just staying at home and having babies. So that limits the population. Another is education, not just on women, but on men as well. The government can come in, or even school systems can come in and educate people, maybe to convince them that having less kids is better. A lot of countries are doing that. Next is the use of contraceptives to limit that population, to lower that total fertility rate. And the last would be government policies, which is getting in our next one. But the government policies, for example, within China, the one-child policy where the government literally comes in and says, you're only going to have a certain amount of kids. The government can step in and do that in some places. Which leads me to my next point. There's two types of population policies that governments can inflict. The first is expansive and then restrictive. Expansive population policies seek to increase the rate of natural increase. You don't see that a lot when you're dealing with the rate of natural increase, but it is happening. Russia is an example of this. Now, the reasons why Russia would want to increase their rate of natural increase is because overall their population is starting to decline. A lot of that has to do with the economy has not been doing well over history. Also with the amount of wars, you don't have a lot of men. The reproduction is not working as well. So they're looking for ways to implement policies that would expand the population. Another that we think about more prominently is restrictive population policies. And these are policies that seek to reduce or to restrict the rate of natural increase. The People's Republic of China is the best example that I could come up with a one-child policy. And the last thing, the timeline of population growth. I've got a timeline here from the start of human history, and then my arrows keep going because we're still alive, we're still breathing. 8000 BCE, before the Common Era. Same thing as BC. The wordage is kind of changing nowadays. But this is the time period of the Neolithic Revolution, which means the ancient river valley civilizations. When people started settling along the ancient river valleys because the soil was fertile, they settled, they grew grew food there, and the population increased. The doubling rate increased because food increased. You can now support more people, and also you needed more people to work the farm, so families would have more kids, so you could work more farms and get more food. Population started to grow. The next was the Industrial Revolution. The idea of having a lot of kids to farm by 1750 CE, the Common Era, what we're in now, AD. The Industrial Revolution happened, doubling rate starts to decrease because of technology and because the idea of we don't need a lot of kids now to work on the farm. Then by 1850 CE, about 100 more years, we have the Medical Revolution. The doubling rate decreases even more because you have things like contraceptives that are being created, but countries begin to get medicines and we begin to live longer, so there's not a need to have more kids. Then by the 1950s of the Common Era, contraceptives are introduced, governments are starting to put them into play, and urbanization continues. Urbanization continues to grow, and so countries are looking at decreasing population, so the doubling rate decreases. Now I'm at 10 minutes, so if you want to stop it, you're good, but I wanted to take this opportunity with this fresh slide to show you how to draw a puppy. There was once a man who had no arms. Poor guy, he doesn't have any arms. He was being chased by bees. He fell into a lake and he drowned. There's his tombstones. He had a big old funeral, and everybody that came cried big old tears. You didn't know you were going to get that today.